My mother had early stage breast cancer in 2019, and I'd actually brought her up to New Jersey, and she had her surgery here and radiation. And as she was finishing up and heading back home, she actually asked me, she said, "Hey, have you done your mammogram?" And I was a couple months late from my annual. So she kept nudging me, make sure you get your mammogram done, and so I obliged. My name is Su Wang. I had DCIS, or ductal carcinoma in situ, and I'm a primary care physician. There was a small abnormality. It required an ultrasound, and I had actually, in my mind, I kept saying, this is nothing. This is nothing, can't I just repeat it, even though it said, the reading said needs follow-up. And thank God my other physician in my practice heard me saying this, or I was telling her this, and she said, "Are you crazy? You would never tell a patient that. Go get that additional study." And thankfully I listened to her and just didn't think about, didn't listen to myself. So I had follow-up studies done, and it showed that I needed a biopsy. And I still remember it was Thanksgiving weekend. I was taking my kids to a track meet up in Westchester when I got the phone call that it looked like it was cancerous. And I just remember walking around with my kids at this park and just thinking, wow, I can't believe I'm on the other side now as a patient. What does this mean for me? So I ended up getting bilateral mastectomy. I had expanders put in, and I had reconstruction with implants. I was, at the beginning, very clinical about the whole thing. So when I first got my diagnosis, started doing like literature search, looking at PubMed, speaking to friends who are breast cancer specialists. But then after my surgery, I realized, none of that mattered in some way. Like really, I just needed to know how to recover. I needed to know how to deal with the pain. It was very helpful actually to find the breast cancer community of patients, of other peers, people who had been through the same thing. I think I'm definitely appreciating small moments in life. I mean, people always talk about that, how, when you have some major illness or some threat to your health, you realize that, at some point you have to stop, and you realize that, you have to make time for the really important things. And as a clinician and somebody who's getting older, there are just all these things that we recommend to people for preventative screenings. And it's easy to say, oh, it will never happen to me, but it's really important, for you to prioritize your health in order to do everything else that you want to do. So if you're 40 or over and you haven't got your mammogram, now's the time to get your mammogram.